My name is Kareem Mims. I work at Prevention Point Philadelphia. My job title is Prevention Healthcare Coordinator. I oversee most of the prevention medical programs in Prevention Point. My job, as I've taken on more responsibilities since I started working here, I kind of act as like a liaison to get people into the right kind of medical care. We have a range of services for the community at large. Right? Who are interested in Hep C treatment, I'll get them set up with their Hep C doctor, but I'll also try to incorporate HIV testing and offer PrEP. If people need help with family planning, if someone thinks they're pregnant, make sure we have the right pregnancy test for them, get them STI tested, make sure they're connected to the right provider. We have housing programs, we have a shelter about 2 blocks away. We also have a syringe exchange program. When I first started coming to Kensington, there were so many needles on the ground. It's not the same Kensington anymore. When I first came on board at Prevention Point, the shift was happening where everything was starting to become more inclusive. I've been working at Prevention Point for 3 years. It'll be 4 years in November. My background is mostly in HIV prevention. I've been working in HIV prevention since 2008. I started working here right in the middle of the pandemic. So when everyone was losing their jobs, we didn't know what the state of the world was going to be like. And I was like, where's a good place to go? And at first it wasn't Kensington. So I'm from Philadelphia. So I grew up here. I've lived here all my life. And so I've seen a lot of shifts over my 37 years of being here, right? When I first was offered the job here, I thought I would be too sensitive. I was never afraid, right? Just felt like seeing so many people who I thought were suffering would have an impact on my mental health, and was really not interested. But 3 years in, I feel more comfortable here. I feel more protected here, even by the staff, the participants, than I do in my own neighborhood. I was talking to a friend one day, and I was walking down the street just blasting Beyonce, Cowboy Carter, and with both headphones on. They picked me up from work, and they was like, "You walk around here with your headphones on?" I was like, "No one's gonna, everyone knows me." We have a lot of patients who don't identify as a part of the LGBT community, but have the practices. As a gay person myself, I can respect that, right? They feel comfortable coming in and talking to us about their sexual health, right? And so I think having a mostly LGBT staff on my team, it helps really educate people, not only about safer sexual practices or even injection practices, but other resources outside of Kensington where people can get things, right? I get into a lot of a lot of dialogue with people in my personal life who don't understand why Prevention Point whole does what we do. I have personal stake, right? My mom was a drug user in the 80s and 90s who passed away from AIDS, right? When I was a kid in Philadelphia, the way that people view drugs was a lot different, right? And I grew up in North Philadelphia, and there were no resources for people like my mother. There were only places for them to die. When people ask me questions about what goes on in Kensington, whether I'm in an Uber, on the way to the bus, whether it's my older brother, my partner, why do you do the work that you do? Why do you go down there every day? How do you feel so comfortable being down there? These people are people. And when I was seeing this as a kid, there was no place for people to get help. Now there is, and I think that's the most inspiring part. I don't pretend we can save everybody, but Prevention Point has offered a place for anybody in the city, right, to get help if they have, if they're battling an addiction, any kind of health resources. Prevention Point is offering a place for people to come. And again, when I was growing up, we didn't have that.